As vaping continues to rise in popularity among teenagers, the concern over easily concealed e-cigarettes has medical professionals concerned.
Shawanda Jones spoke with experts about the dangers these disguised devices pose to children. Shawanda.
Is it a pen or is it a vape? Is it a smartwatch or is it a vape? It sounds silly to ask, but these are serious questions to think about when it comes to a child's well-being at risk.
A vape hoodie.
From vapes that imitate clothing and medical devices to those that double as school supplies.
They're very easily hidden.
Vape brands are marketing these smoking products to look like everyday items. Mississippi University for Women assistant professor and nurse practitioner Beth Turner describes what teachers and parents should be on the lookout for.
Students vape in class. According to students that I have interviewed and talked to, patients will tell me how easy it is to vape, how easy it is to have access to the solutions, to the different types of vapes. They look like little flash drives that you plug in a computer. They can hide it in their sleeve and pull their sleeve up and vape in the middle of class. So there are lots of ways for it to be hidden.
Most e-cigarettes use the drug nicotine as a liquid concentrate. Pediatrician Byron Watson says nicotine negatively impacts the body and mind regardless of age.
So nicotine is addictive. It can be a gateway use to other substances that are harmful. And overuse can cause poor school performance, poor sleep, anxiety, other psychological, mental disorders, chronic headaches, chronic fatigue, poor focus, a list of things that can affect the social, behavioral, and even physical health of anybody that uses it, whether they're an adult or a teenager.
Mississippi law states no persons under the age of 18 are allowed to buy or use any type of nicotine, but the CDC reported 1 in 5 teens vape regularly. The University of California, San Francisco says nicotine has proven to be just as addictive as cocaine and heroin. Watson explains how to spot nicotine addiction in kids.
If they are starting to report that without it, they can't go to school, or without it they can't sleep, or they constantly feel anxious or nervous without it, that they have it to function day to day, then you're in the world of addiction.
Turner says no parent is immune to their children being exposed to vaping and should act now.
If a parent is naive and believes that their child or the friends of their child are not vaping, then I urge them to educate themselves, because the only way really to improve rates is going to be to educate teens, educate the parents about the risk and about the stats. If the parents understand the stats and they know their kids are exposed to it, maybe their kids aren't vaping but they're exposed to it, so they need to be talking to their kids now about all the risks.
Check out our website for more educational resources on what you can do to help protect our children from the dangers of vaping.